Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left mandibular region. Now, this is a young child, approximately 7 to 8 years of age or 6 years of age. The lower and upper incisors here, so we are presuming she's 7 years to 8 years of age. Lower molars are out as well. Second molar is not out. She has a grossly carious lower left 6. Now, on the CBCT or the 3D rendering, you can clearly see there is bony expansion of the left side of the mandible, and this bony expansion has a pattern which can be seen perforating the cortical plate of the mandible as well. The right side mandible seems appropriate and it seems fine except one lesion right here, whereas the left side of the mandible, the body of the mandible seems to be affected by this particular problem. Now, on the axial view, which is the top to bottom view, on the axial view, you can very clearly see that this is the mandibular molar. As you're moving down, we can see that there is a radiolucency which is relatively unilocular in its appearance, and this radiolucency is extending from the premolar region all the way down to the ramus of the mandible. And as you can see, this is superficial. It is and now this is how the entire mandible on the left hand side, even on the anterior segment, you can see it's clearly involved quite significantly. On the sagittal view, which is the side to side view, here you can see that the lesion is part of the ramus here. This is the third molar crypt. This is the second molar, which hasn't developed completely. It's still in the crown stages. This is the grossly carious lower left 6, and this is the lesion you can see is extending all the way anteriorly towards the impacted premolar as well. So this is definitely a cause of concern, and we would highly advise the parents and the family to have this biopsied, and the primary physician will have this biopsy as soon as possible. This is a small chart for our doctor. If we can just show you this chart identifies the possible lesions that can be involved. We're looking at a radiolucent lesion with a well-defined border, and these are unilocular, the simple bony cyst, Langerhans cell histiocytosis, and Staphy's cyst. It could be aneurysmal bone cyst, it could be a Brown's tumor, desmoplastic fibroma, could be a hemangioma, could be osteomyelitis, could be an osteosarcoma. So we will definitely advise. It could be an osteoma as well, but that's highly unlikely. We will definitely advise our doctor to have a detailed biopsy and refer this patient to an oral surgeon as soon as possible. Thank you very much.